Good day again, everyone. My name is Andy Mazzio. Thank you for attending Tetra Tech's second COVID-19 related webinar. Today's topic is the science behind coronavirus disinfection, distinguishing fact from fiction as America reopens for business. The webinar will resemble a live TV broadcast. All attendees are globally muted and can follow the shared screen. As we get started, you can send troubleshooting questions using the Q&A tab in the upper right-hand portion of your screen. Hopefully we address most of the technical questions early on in the process. We will also be collecting questions you may have on the content throughout the presentation. We anticipate you may have some questions, and presenters will be able to follow up with you afterwards, provided you don't submit your questions anonymously. So please provide your name and contact information. With that said, I am pleased to introduce our featured presenters today, Mr. Joe Gavashevsky and Mr. Mike Johnson. Mr. Gavashevsky is a certified hazardous materials manager, serves as a senior program manager and environmental scientist at Tetra Tech for the last 20 years. He draws upon his practical experience in responding to biological agents such as anthrax, ricin, and Ebola, and regularly facilitates training for 100, if not thousands of professionals each year. Joe is accompanied again by Mr. Mike Johnson. Mr. Johnson is a certified industrial hygienist and professional engineer with over 7 years experience. He has specialized expertise in studying effects of chemical and biological exposures, as well as indoor air quality and health and safety planning. Joe, the floor is yours.
Thanks, Andy. Hi, everyone. This is Joe Gavashevsky and Mike Johnson of Tetra Tech. Welcome to our webinar. We are not the guys from Discovery Channel's Mythbusters, but we do want to share our thoughts on the truths behind disinfection during this current pandemic, whether it's a response to a positive case at your facility or to the many of us looking towards a safe reopening of business and commerce. When it comes to disinfecting for SARS-CoV-2, any of these topics you see here could easily turn into a lengthy webinar or a workshop. Debates, questions, and unfortunately, junk science continues to grow in regard to disinfection activities. Here's a snapshot here of a recent New York Times article deliberating on the usefulness of disinfection. Fortunately, we are seeing an increase in innovations and resources. I'm not sure how many of you have seen Disinfecto, which is a Singapore disinfection robot. We're going to plan on presenting a presentation that's not exactly exhaustive. And as you know, the guidance continues to change. But our charge to you all is to try to pick up one or more new things that you did not know before. Our presentation will include lots of references to studies and published guidelines for a reason. So we're hoping that Mike and I show you that although we are in the dark on many aspects of how SARS-CoV-2 operates, I heard it referred to recently as a microscopic war with an unknown enemy. We just hope that we show you that at least some of this territory is not completely uncharted. So I know you might be asking, why am I showing you a photo of a beat up 1987 Nissan Sentra? This was my first vehicle, and I think the stereo system costs more than the car. But when it comes to disinfection and the calls that we get from industry, homeowners, local state agencies, and other consultants, we usually get questions like, how long is it going to take, or how much? But the reality is with those kind of questions, they're going to be answered by us with a dozen more questions. Back to this Sentra here. If I'm having car trouble and I call a mechanic out of a phone book, if you remember what those were, and you ask, my car seems to be acting up, what do you think? I'm going to be very, very skeptical to a mechanic that replies immediately and says, 2 days, $400. That car, it needs proper diagnosis, hopefully from a mechanic that's worked on similar vehicles, similar problems. If not, there's a good chance that mechanic overestimated the labor, the parts, the effort. Maybe even worse, they could underestimate. The same goes for your approach to disinfecting facilities. Is your facility a two-door Nissan Sentra? Is it a minivan? Is it a fleet of trucks? Strategies for disinfection need to be pragmatic. That's one of my favorite words. You should deal with your disinfection situation sensibly, realistically, and definitely in a way that's based on practical rather than theoretical considerations. So we're going to leave my car here, and we'll start with the virus itself. A little more than a packet of genetic material surrounded by a spiky protein, about 1,000th the width of an eyelash. It definitely leads a zombie-like existence. It's barely considered a living organism. But perhaps one of the most encouraging aspects of the SARS-CoV-2 outbreak is that virus, it's enveloped. So the structure of these viruses, they have a lipid envelope. Think of an M&M and the candy-coated shell, if you will. It can be easily compromised by most disinfectants. Once that lipid envelope's damaged, the integrity of the virus is compromised, and it neutralizes its capacity to infect. There's other pathogens that are ripped in lipid membranes, other coronaviruses, HIV, the viruses that cause hepatitis B and C, Ebola, Zika, and there's a whole bunch of bacteria that attack our intestines and our respiratory tract. That lipid envelope, it's flimsy. For example, we know that alcohol-based products disrupt the lipid layer. That stops the virus from being able to recognize and latch on to host cells. Alcohol solutions at the right concentrations can deactivate that virus within 1 minute of contact time. Quick word on non-enveloped. Despite the lack of that lipid layer, non-enveloped organisms, they got a very resistant capsid. It's a shell made out of protein. That protein capsid, that's actually very resistant to several disinfectants, as well as some solvents. That's kind of important. One of the criteria that EPA used for its list of disinfectants against SARS-CoV-2, once again an enveloped virus, is that it has efficacy against one large or one small non-enveloped virus, which are harder to kill. We know through studies with other pathogens that disinfection can lead to decreased transmission. I've heard that the SARS-CoV-2 pandemic is somewhere between biology and chemistry, and I feel that's accurate. There's this concept here of product plus practice, which we'll cover a little bit further more when we talk about the disinfectants themselves. Not using inferior products that will not break down the envelope. And then the criticality of practice, considering things like contact time, consistent approaches. It's when you combine that product and practice that you're going to have effective disinfection. And I know I just described SARS-CoV-2 as a zombie, but it has great tenacity. And we know that's possible for a person to acquire it by touching a contaminated surface and then touching his or her own mouth, nose, eyes. Let's take a little closer look here at SARS-CoV-2 viability on different surfaces. Just looking at those bullets at the top, viruses can't survive independently. The whole point of a virus is to invade a host, hijack it, and produce. So when an infected person coughs and droplets land on the surface around them, it's not exactly the outcome that virus was hoping for. The graphic below, that demonstrates how SARS-CoV-2 has been found still to be infectious after being in air for a number of hours, and also shows why we need to be concerned with those simple things like hygiene and disinfection product and practice. This is the interactive portion of our presentation here. If you focus on the panels, I'll give you the first one. This was a study on aerosol and surface stability of SARS-CoV-2 as compared to SARS-CoV-1. It was published by New England Journal of Medicine about 2 weeks ago. Basically, these charts are showing exponential decay. Lots of similarity between the coronaviruses that cause SARS and the one that causes COVID-19. So I think the first one's pretty easy. Aerosol, that comes over into the first panel. In the air, the team found the viruses, they can stick around for about 3 hours. In air, its estimated half-life, the median half-life is, which is the time it takes for that half the virus to become inactive, was just over an hour. And the levels of the virus that do remain in the air, they're not high enough to pose a risk to most people who are not in the immediate vicinity of an infected person. All right, our second panel, here it comes. Copper, that's one of the most hostile surfaces tested. Lasted just 4 hours. Middle panel, that's our cardboard. SARS-CoV-2 typically survives on cardboard for up to 1 day. This was interesting to me. It's about 3 times as longer than the SARS-CoV-1. Although the data is a little bit noisier, if you look up there, there's some standard error. Last two, stainless steel in practice. The longest viability of both viruses was on stainless steel and plastic, up to 3 days later, still there. Why that virus can survive longer on some surfaces rather than others, that still remains some sort of a mystery. Maybe it has to do with consistency of the object playing host. Cardboard, which we know is porous, more porous than steel or plastic. And the virus doesn't typically like to live on surfaces that have a lot of small microscopic grooves on them. It likes surfaces that are smooth, like doorknobs or light cover switches. This study and other similar ones do reaffirm our need to disinfect surfaces to kind of reduce that chance of infection. I'll let Mike talk a little bit how we approach disinfection activities, and of course, we're going to start with planning.
Thanks, Joe. So the scope of the disinfection response should really be tailored to the type of facility. And so this presentation is more geared towards community facilities, so schools and offices, for example. This should really be viewed as general guidance. For a specific case, you really want to reach out to a qualified professional. So your disinfection plans and protocols should work within your larger company pandemic plan. And we're mostly going to talk about the steps of response to a confirmed case of COVID-19 in a facility, which will differ from enhanced routine disinfection, which is your day-to-day cleaning and maintenance. And some health and safety components to touch on that should be part of your cleaning and disinfection program. And the larger pandemic plan should include things like hazard communication, personal hygiene, PPE use, and the training, documentation, and review associated with those programs. All right, so for a case response disinfection, these are general steps based off of CDC's cleaning and disinfection for community facilities guidance. So you have isolation of the contaminated area, ventilation of the isolated area, cleaning of surfaces and content items, disinfection of cleaned areas, and verification that the cleaning and disinfection was performed properly. So isolation, so you want to close off areas visited by the confirmed case and prevent access to those areas. These should include places the person visited over the past few days, as we've seen, due to the virus survival time on different materials. You may want to consider isolating areas served by the same ventilation system, although in some cases this could be a pretty conservative approach and also logistically challenging. So, this kind of emphasizes the need to evaluate the response, on a site-specific basis. For ventilation, you want to ventilate your isolated area with outdoor air, whether it's natural ventilation by opening windows and doors or running your ventilation system with some adjusted settings to introduce more outdoor air. And you want to ventilate for 24 hours or as long as practical. And certain areas like closets, for example, might not have ventilation, so you can use additional fans to circulate the air as needed. Some additional recommendations by ASHRAE, which is the American Society of Heating, Refrigeration, and Air Conditioning Engineers, for emergencies and non-healthcare settings. In addition to increasing outdoor air rates, they recommend improving filtration. You can run the system for longer hours, incorporate portable HEPA or UV devices, and bypass energy recovery systems. And they have a epidemic task force, and their view on the epidemic is that airborne exposure should be controlled, and changes to the building ventilation system can reduce airborne exposures. Ventilation and filtration can reduce the risk of transmission, while unconditioned spaces can lower resistance to infection for a few reasons. So in general, they don't recommend disabling ventilation systems. Now Joe will cover the next step, which is cleaning.
Thanks, Mike. So cleaning, I have a local convenience store here, and recently they announced one evening that one of their associates tested positive for COVID-19. They announced that the store was closing overnight for what they called deep cleaning. And the next morning, I noticed that store was open at daybreak. And I scratched my head trying to think, what exactly does deep cleaning mean? Deep cleaning is not a scientific term. You look at some of those other terms up there on the slide. Extreme cleaning, that sounds like something like cleaning while you're riding a snowboard, maybe. Decontamination, that usually refers to personnel, tools, equipment. Sanitizing, it's a CDC term, and I can get behind that. That's lowering the number of contaminants on surfaces to a safe level. as judged by public health standards. But the focus here is cleaning and disinfection, those two terms. This is what CDC concentrates their process guidelines on, and you'll see here that cleaning and disinfection, they're interconnected. Just 1 week ago, EPA and CDC, they provided their cleaning and disinfection decision tool. Mike and I, we were working on this presentation before that, so we were thrilled to see that the guidance mirrored what we've been emphasizing here. Planning, as well as the relationship between the terms of cleaning and disinfection. You can see that screenshot there. The first third of their tool just focuses on developing a plan, and the last third just focuses on maintaining and revising your plan for disinfection. So cleaning, that's removing. Cleaning removes dirt, particles, impurities from the surface. Usually works with soap or detergent and water to physically remove stuff. Process doesn't necessarily kill, but by removing, it lowers those numbers and the risk of spreading infection. Disinfecting, that kills. It kills viruses on surfaces or objects, typically using chemicals. This process does not necessarily clean dirty surfaces or remove the viruses, but kills the virus after surface cleaning. It can further lower that risk of spreading infection. To really clean from a scientific standpoint, from a technique standpoint, it's really an art. An inept cleaner, they will miss areas. Lack of training, improper protocols, that can expose a worker to infection, something we saw while working during the Ebola crisis and with environmental and housekeeping staff. Let's talk about some of those chemicals and some of the disinfectants. I know I tell a lot of stories, but there's an Italian restaurant near me that offers takeout during these times. And I was on their social media recently to check out what their daily specials were, and I noticed a post about a cleaning firm that was sterilizing the restaurant. And there was a photo, and the person in the photo, they had their respirator strapped over their hooded Tyvek, but that's kind of besides the point. But someone commented on the photo and said, "What chemicals do you use?" And I thought that was a great question. And the responding comment from the cleaning company said, proprietary blend. Now that might be fine, and I'm sure my raviolis are safe, but when we speak about disinfection to disinfection contractors and about their products, I appreciate when they say brand names, Shockwave, Virex, or something that I can easily look up on EPA list N to understand things like contact times, PPE hazards, engineering controls. My mechanic tells me they're putting new brakes on my Sentra, and I want to know, are they going to be metallic? Are they going to be ceramic? Is there a world demand on a certain brand of semi-metallic pads? Is there a comparable product? Those types of questions. So this graphic here, it's a snapshot of different types of disinfectants out there. There's alcohols, and this is myth busting time. Alcohol for human consumption, not really effective as a disinfectant. Warm soapy water, vinegar solutions, essential oils, they're not disinfectants. Disinfectants are reducers. They're oxidizers like bleach and hydrogen peroxide. There's those ammonium salts, which we see in a lot of hospital and restaurant type disinfectants. Take home point here for disinfectants, read the labels. EPA, they regulate disinfectants under their authority to regulate pesticides. And they're going to stand behind the promises on those labels as long as you follow the instructions. The labels, they'll tell you how to use disinfectants safely, for example, in a ventilated area. They'll explain which products shouldn't be mixed with other chemicals. And unfortunately, I know we're all hearing about chemical exposures on the rise. Even the type of cloth you use when cleaning hard surfaces might alter how the disinfectant works. Paper towels, they can decompose after long soaks in some disinfectants, and that can actually deactivate some disinfectants. Remember, I was talking about the enveloped nature of SARS-CoV-2. There's a wide variety of disinfectants that can disrupt that lipid membrane and kill the virus. But in reality, relatively few disinfectants have actually been tested against SARS-CoV-2 in the lab. EPA has fast-tracked and maintained their database. I believe it's up to over 400 now, based on proven efficacy against similar viruses. You can search that list by product name, active ingredient, type of product. Advance here. As I said earlier, effective disinfection, not only effective product, but also effective practice. The disinfection procedures, I mean, you can read CDC's step-by-step procedures for yourself, but this is where Mike and we've really been spending most of our time. reviewing clients' plans, sometimes updating. Maybe they just had an infectious disease plan, sometimes developing from scratch. And typically, Mike and I, we start with a framework and then we fill in and we customize it. The fact is there's no perfect disinfection protocol, and that's where that pragmatic approach that I mentioned, that's where that can come into play. So looking up here, hard surfaces, non-porous surfaces. Obviously, we're going to look at high-touch areas. We make those kind of determinations early on. Honestly, this could say don't focus on non-touch areas. I know that's a double negative probably, but you need to really have an effort to disinfect the top of a 6-foot tall, filing cabinet. Soft surfaces, that's your carpeted floors, rugs, drapes. There's recommendations to launder items using the warmest appropriate water setting for items, and then dry the items completely. Mike, what about some tips for carpet?
Yeah, so for carpet cleaning, use of a normal vacuum is actually not recommended. You want to use a HEPA vacuum to prevent dispersing potentially infectious dust. And in place of shampooing, cleaning with hot water injection is actually recommended instead.
Gotcha. Electronics, we get a lot of questions about that. For cell phones, tablets, touchscreens, remote controls. You want to follow manufacturer guidance if it's available, but if not, CDC recommends alcohol-based wipes that are at least 70% alcohol to disinfect things like touchscreens. Of course, you want to dry those surfaces thoroughly to avoid any kind of damage, pooling of liquids, that kind of stuff. One last thing, I think it's prudent to pose this question: is all of this a waste of time, since the outbreak is going to come back in the fall? And I would honestly say no. Routine cleaning of frequently touched surfaces, using disinfectants when appropriate, that's something that CDC has encouraged since well before this pandemic. Anytime that you can minimize your exposure, you're helping yourself out. Taking the time to properly disinfect now before your colleagues and customers return, that's going to make you be better prepared in the event of a resurge. So I'm going to say that's worth the effort. Now back to Mike here. This is a question that we get daily. How do I verify my disinfection efforts?
Yeah, so it's difficult to definitively know, but there are definitely some best practices that can be done. So depending on the size or the nature of the job, you may want independent oversight during the cleaning process to provide documentation and corrective action during activities if needed. After disinfection, you want to have someone inspect the space to confirm that all the clean surfaces and items don't have visible residues, determine the need to re-clean any surfaces, and verify that everything was completed according to the work plan or the scope, and document what was done. Surface testing can be considered as part of clearance. And currently available testing includes ATP testing, which is a field method that can provide very fast results, generally less than a minute for the presence of ATP in a surface swab. It's an indicator of living biomass, so it doesn't directly measure the virus, but really it's a semi-quantitative measurement of bacteria or dirt remaining on a surface. So for example, it's often used in food safety. Labs are also offering surface swab testing for SARS-CoV-2 with analysis by PCR, which very basically screens for genetic signatures of the virus, and it will give a presence-absence result. So, while testing can provide some additional information as part of clearance, there are definitely a number of limitations. So, a lack of validated methods, limited supplies, potentially collection error, and really a lot more. So it's really important to have someone qualified to determine a sampling plan ahead of time, and establish response actions based on the results, and someone who understands the limitations and confounders associated with the different methods. And often testing is seen as one of the most important parts of a response, but it really shouldn't diminish the emphasis on proper planning, training, and implementation of response measures. Joe, any additional thoughts on sampling?
Yeah, the sampling questions that we get, that's one of those depends questions. There's sampling guidance available based on previous responses, mostly microbiologic type sampling plans, a sampling scheme. That's going to involve a lot of variables: the facility itself, square footage, number of floors, the occupants. Is it a meat packing plant, or is it a 5-person accounting office? Maybe it's a large receiving warehouse, but only 2 full-time staff working in that space. So you combine those variables along with sample QC, and you can apply conservative factors, and you can basically develop decision units based on the size and the areas of the facility, all with the goal of a representative sample. Something that you definitely want to stay tuned as guidance is being developed specific to SARS-CoV-2. WHO, they focus their sampling approach on healthcare settings. Definitely takes a biased approach, a focus on high touch areas, Mike.
Yeah, all good points. So beyond testing, some additional considerations after you've had an area that's been unoccupied for a period of time. Resetting the ventilation system to normal operating settings or some improvements on this, and consideration of Legionella in the stagnant water systems, including potable and processed water. All right, so routine cleaning. Routine cleaning is really important because you're constantly working to prevent transmission from potentially asymptomatic individuals. So it's really a preventative measure as opposed to a reactionary measure with case cleaning. So you want to establish a frequency and specific procedures on things like based off of occupant use patterns, size and population of the facility, and content items at the facility. And it's helpful. There's a few ways to focus your resources. So for surfaces not frequently touched, those can just be cleaned. They don't necessarily need to be disinfected every time. You can isolate common areas that are no longer used to reduce the number of areas requiring enhanced cleaning. And you can also remove or isolate frequently touched content items or difficult to clean porous items from common spaces. And a few additional routine measures, again, just PPE and cleaning procedures and the training associated with that, and ventilation improvements. All right, so one more slide here on an overview of some myths and things not to do. Fogging, you often see pictures of foggers in the news, but it's really not recommended by CDC or EPA. And others because it's difficult to determine exact quantities required to be effective, and you're introducing a chemical hazard, which is a risk of exposure to surrounding occupants. Sanitizing tunnels, basically being misted with a disinfectant when entering and exiting an area. CDC doesn't recommend these due to unproven effectiveness and again the potential for chemical exposure. Some ineffective cleaning alternatives. I think Joe mentioned there's rum and vodka. You're using vinegar, things like that. Red colored soap I've seen. You really want to just stick to the EPA list. And warm weather. So UV from the sun doesn't effectively destroy the virus quickly. Seasonality of viruses is really due to warmer temperatures, higher humidity, and changes in human behavior, and not necessarily because it's sunnier. And Joe has some of the current resources available on where to find out what should be done.
Thanks, Mike. The resources, as you can imagine, they're growing. Here's a list of some that can help guide you. The top half, that includes WHO and a variety of .govs. The bottom half, that includes organizations like AIHA and their main page. They also have a new page, Back to Work Safely, that's more intended to industry-specific guidance for businesses and for consumers. Over on the right side of the page, disinfectant companies. Yes, Clorox and Lysol, they've got some pretty comprehensive full pages dedicated mostly to their products, but also some helpful resources. When I say large construction sites up there, I'm talking about projects, not websites. Think about essential businesses that have had to maintain infrastructure and construction projects, all while developing cleaning and disinfection protocol, task cards, action plans, those types of resources. And of course, academia and healthcare, including those that blend the two, like Harvard Health or Johns Hopkins, great sources of information, along with states and industries that are desperately trying to reopen safely. think we got it just on time. I got 2 o'clock Eastern. So Mike and I also want to reopen safely and get back out there. That's a photo of my favorite national park, Glacier, and that I took, and that's a photo to the right that Mike took of the Badlands on a recent trip cross country. So we hope that our challenge to you to pick up something new worked. I know one of the themes of my slides was product plus practice, and if you combine that with Mike's take-home message of planning, I think that right there is the science behind effective disinfection. There's a lot of evolving science with SARS-CoV-2, diagnostic testing, contact tracing, and of course, vaccine development. They're all great undertakings. Cleaning and disinfection, that shares a common objective with those activities. Reduce the risk. Even if the risk is small, reduce it. So the nice thing about live events, MS Teams live events, is that we have a complete Q&A log. Mike and I will be able to focus on those questions, respond to them. Even better, I think that Q&A log, that could be turned into a list of FAQs as we continue to work in this area. So I thank you all for taking the time to attend. Andy, say a few words.
Yeah, thanks a lot, Joe. So just great job, guys, and wanted to just put a plug in for next webinar that we're going to do 2 weeks from today. I believe that's the 20th of May. Chrissy Angeletti, one of our recovery specialists, is going to be giving some insights to coronavirus financial aid, keys to understanding the benefits and limitations of available federal funding. So thank you all for your participation and attention today, and we'll talk to you all again soon. Thank you.